Hey athletes and hoopers, so I'm currently taking a quick small stroll with my dog, and there's another question that is asked quite frequently is how you should deal with knee pain. I think knee pain, or like pain in general, is just a signal to your body that something is wrong, right? And you shouldn't push past through it. So I think we should really get rid of the no pain, no gain mindset or mentality. That is not good in terms of athletic development or just strength development in general for athletes or even the general population. It's a signal at the end of the day to tell us that there's something wrong, and we should be wary of these danger that it could cause long-term issues afterwards. So, for example, if you're dealing with knee pain, right, you want to first find out what aggravates it. So for some people it's knee extension, and for some people it's going to be bending your knee, so into knee flexion, or maybe into deep knee flexion. That's when the issues occur. So once you find the aggravating factor, maybe it's like pivoting as well, then you want to figure out a way or find factors that ease the pain. So you want to find maybe it's bending your knees right above the point and doing it for maybe 100 reps or 200 reps to really get the blood flow going. Then the pain slowly subsides and you feel better. For some people, it might be doing some knee tendon isometrics. So maybe it's in the split squat iso or doing some Spanish squats and just getting that blood flow into the tendon and the joint, and that might help with it, right? Another one, it could be just hammering the structures around it. So not really even working on the quads, but the contraction of the knee. So some of them, it could be hamstring bridge isos, right? Really firing up the hamstrings, the calves, the posterior chain. When you feel like bending your knees, using your quads can be painful, right? That could sometimes help with or alleviate your knee pain as well. So it's more about finding ways around the knee pain rather than just actively or passively resting and recovering on your bed and not doing anything. I think that's the biggest thing that I've seen athletes do, and understand that sometimes complete rest is important. Just by doing like upper body work or core training and such, it just signals your body that this is not as life-threatening as you think it is. So it kind of reduces the severity of the thinking that you might have with it, and it will probably help with the recovery time, because psychologically you're thinking that it's not too serious. But if you feel like you're always having muscle guarding around it, you're always not trying to load the knees at all, then your body is going to be more and more cautious of it, and your nervous system is going to be so much more sensitized around it. Then your knee pain might start to get worse and worse and worse, and it goes to a point where it maybe becomes chronic, right? And of course, knee structures, knee pain is a funny one. Of course, there's going to be some times with ligament injuries, maybe like ACL, PCL, meniscus injuries, fat pad, maybe it's like the popliteus behind it. But at the end of the day, I think there's a lot of stuff that you can do with conservative treatment. Just really getting the knee joint moving a little bit, getting the hips going, getting the calves going. And sometimes just by hammering the structures, not even at the knee joint, it already helps you with alleviating a lot of that pain. So my final advice or key takeaway from this video is to not, of course, push past pain, right? Find a way to work around the pain. And finally, don't completely rest and ice. All right, so these are kind of the three main takeaways for knee pain, for hoopers and athletes. Figure out a way to hammer around it, and your knee pain should be much better in a few weeks' time, or maybe in a few days' time. So hopefully this video helped. And if you want more content like these, make sure to follow at NoCap Physio.